It was just after midnight when a 58-year-old man named Roberto walked into the emergency department. He looked exhausted and slightly pale, holding his chest with one hand. At first glance, it looked like another routine complaint of chest discomfort. But something about his symptoms immediately caught the nurse's attention. Roberto described a strange pressure in the center of his chest that had started about an hour earlier while he was watching television. The pain wasn't sharp. Instead, he described it as a heavy weight sitting on his chest. The discomfort slowly spread toward his left shoulder and jaw. He also mentioned feeling unusually sweaty and slightly nauseated. These symptoms raised a serious concern: a possible heart attack. Inside the heart, the muscle depends on a constant supply of oxygen delivered through the coronary arteries. When one of these arteries becomes blocked, often by a blood clot forming on top of a ruptured cholesterol plaque, the blood supply to part of the heart muscle suddenly decreases. Without oxygen, heart cells begin to suffer damage within minutes. The medical team quickly began their evaluation. Roberto's vital signs showed a slightly elevated heart rate and mildly increased blood pressure. An electrocardiogram, or ECG, was performed immediately. The ECG revealed subtle changes in the St. segments, which can indicate that part of the heart muscle is not receiving enough oxygen. Blood tests were also ordered to measure cardiac biomarkers, especially a protein called troponin. Troponin is released into the bloodstream when heart muscle cells become injured. Within an hour, Roberto's troponin levels came back elevated. This confirmed the diagnosis, a myocardial infarction, more commonly known as a heart attack. The treatment needed to happen quickly. Doctors administered medications to reduce clot formation and improve blood flow. Roberto was then taken to the cardiac catheterization lab, where a cardiologist inserted a thin tube into one of his arteries and guided it to the blocked coronary vessel. Using a tiny balloon and a metal stent, the cardiologist reopened the artery and restored blood flow to the heart muscle. Fortunately, because Roberto arrived at the hospital early, the damage to his heart was limited. This case highlights an important medical lesson. Heart attack symptoms are not always dramatic. Sometimes they begin with subtle warning signs. Recognizing these early symptoms and seeking medical help immediately can make the difference between recovery and severe heart damage. In medicine, time truly is muscle. Thank you for watching.